Hello, my name is Dr. Neil Baum from New Orleans, Louisiana, and I would like to share with you in the next 8 or 9 minutes a problem-solving solution referred to as the 5 whys. If your practice is like my practice, you probably have had problems or situations that occur where you use the stopgap or band-aid solution. I would like to give you an alternative referred to as the 5 whys. And I'd like to give you an example using the Lincoln Memorial. At one time, the memorial was closed to tourists, and the tourist asked, "Why is the memorial closed?" The answer was, "For cleaning purposes." Second question, "Why does it need to be cleaned?" There was dirt from the pigeons pooping on the memorial. Third question, "Why are the pigeons at the memorial?" The pigeons are looking for food and eating spiders. Fourth, "Why are there spiders at the memorial?" Spiders eat the moths. And why are there moths at the memorial? The moths are attracted to light. So the solution to the problem by using the 5 whys was changing the type of lights that were used to illuminate the memorial that eliminated moths and spiders and pigeons, and the necessity for closing the memorial for cleaning. So what will this video cover in the next few minutes? I'll discuss with you the root cause analysis, how to identify the root cause analysis using the 5 whys, and how to get started. So why look for the root cause? The root cause identifies the goal in finding a solution to the problem that you are experiencing. It allows you to implement the solution, and finding the root cause of most problems in a urologic practice can easily be accomplished because it prevents problems from happening in the future. The cost of implementing the solution to most problems using the 5 whys is usually inexpensive. So let's take a look at 5 whys in a urologic practice. One of the issues that affect most practices is that the schedule never seems to be running on time. So why is the practice behind schedule? Answer, patients are arriving 30 to 60 minutes late. Why are the patients arriving late? Because the doctor is usually 30 to 60 minutes late. Why is the doctor late? Because the patients are taken to the exam room at 9:30 when the practice is supposed to start at 9 o'clock, and the doctor goes to look at his computer to answer emails. Why does the doctor look at the computer before seeing patients? Because the patients aren't in the room 30 minutes before their designated appointment time. And the staff doesn't arrive until 8:30 and not ready to put the patients into the room until 9:30. The solution becomes readily apparent. Have the staff arrive at 8 o'clock. Have the staff put the patients in the room at 8:45 and tell the patients that they are to arrive on time and that they will be seen at 9 o'clock. Encourage the doctor to come to the office before 8:45, and then the patients can be seen promptly at 9 o'clock. So how do you find the root cause? The goal of finding the root cause is to identify the solution to the problem. Also, you want to identify the root cause to prevent it from happening in the future. And usually the cost of implementing a solution to root cause analysis is very inexpensive, and it's usually only the cost of time that it takes to identify the root cause. So how do you get started? Look at the problem from the patient's point of view. For example, when we talked about delays in schedule, from the patient's point of view, the patient isn't happy, and it'll ultimately impact patient satisfaction and the doctor's and practice's online reputation. Patients also will complain frequently that they have been requested to take a lab test or an imaging study, and they don't get the report back for 2 to 3 weeks after the test or the procedure has been done. So you need to drill down into the root cause until you identify the problem. I want to emphasize that when conducting a root cause analysis, the purpose is to find the cause and not to place the blame. So getting started, you need to identify and find out the facts first. You need to distinguish the causes of the problem from the symptoms of the problem. Again, back to the scheduling problem. The doctor doesn't start on time is the problem. The symptom is that the patients are upset. In order to conduct an effective root cause analysis, you have to involve everyone concerned. That is not only the physicians and nurses, but the receptionists, ancillary personnel, and even the office manager. You need to focus on the long-term success rather than the Band-Aid or the quick fix solution. So getting started, you need to identify the problem and write it down and focus on fixing the problem. Keep drilling down and asking why until the root cause is determined. Then conclude with the solution that may prevent the problem or the errors. It is important to obtain consensus or agreement on the solutions from everyone involved on the team or in the practice. You want to implement the changes and then study and evaluate the improvement and then tweak or make any necessary additional changes. In summary, you want to identify the factor or factors that are causing the problem. Determine the behaviors, actions, and situation that is needed to be changed. You want to prevent reoccurrence and perhaps harmful outcomes by identifying the root cause. By improving outcomes, you also improve patient experience and patient satisfaction. Bottom line is that the root cause analysis prevents the Band-Aid or stopgap problem solving, which is currently used in most practices to prevent a crisis from occurring. By identifying the root cause analysis, you reduce the frequency of problems that occur within the practice. And most importantly, it creates a practice that clearly demonstrates to staff and patients that you are embracing progress. I hope you have found this root cause analysis and using the 5 whys helpful in solving problems for your practice. If you have any ideas or suggestions that you use in your practice for solving problems, kindly let me hear from you at my email address on the last slide. Thank you.